Good morning. Thank you so much for joining us again today for our Patient Empowerment Series. We've been so excited about bringing this information to our cancer survivors, caregivers of cancer patients, and to the healthcare professionals. And because we are so excited about this, one of the things that we just take pride in knowing that there are people out there willing to share information so that patients can get the resources that they need. And so this week we've had one session already, and now we're doing our second one for this part two series. And with this one, we've got one of our speakers who is coming to us from the National Coalition of Cancer Survivorship Program, who is Ms. Shelley Fuld. She's the Chief Executive Officer, and she advocates to transform the cancer care system for everyone that is touched by cancer. NCCS engages in public policy efforts to improve cancer care and empower cancer survivors, caregivers, and to be a voice in the public policy debates. She served on numerous advisory committees presenting cancer patients and survivors in discussions about research, care delivery, and quality measurements. Prior to joining NCCS in 2013, she led public policy efforts at Susan G. Komen. She lives in Dorchester, Maryland, with her husband and three sons. It is so exciting to have her on with us today. I met her about, I guess, 3 or 4 years ago, and we were lobbying on Capitol Hill, trying to get those great senators and representatives to see how important cancer matters to us as patients, as advocates, so that we can not just empower ourselves, but empower those in our respective communities. And so, as we go along with the chat today, with the talk today, you'll see a chat button at the bottom of your screen. If you have any questions or comments, please put them in chat and we will address them at the end of her presentation. Also, we'll leave rooms for other interaction. Tia Tomlin is going to come on, who is one of the co-hosts for this event that we've been doing in this series. And she's going to do the Q&A session and share with us more about our sponsors. We try to make sure that as we go along with these different series, as an incentive, we have gifts for those that participate. So each person's name is put in a drawing and you will have a gift according to the name that's drawn at the end. So we will share more of that information toward the end of this session. So with that, I just want to introduce to you all my friend Shelley, and she can take it from here. Thank you, Shelley.
Thank you so much, Miss Loretta, and thank you to you and to Tia and your organizations for putting on this series and for inviting me to be a part of it. I've listened to some of the other presentations, and it's been a great source of information, and it's an honor to be here with you guys. You are both incredible, amazing advocates who've used your own cancer experience and your family's experience to then turn it into a way to help other people. And I'm really grateful to even know you and honored that you asked me to be part of this. So let me bring up my slides. I have some slides I wanted to go through, but then I look forward to answering questions and to the conversation. We're talking today about navigating life post-treatment, but first I want to just tell you a little bit more about NCCS. And as Loretta mentioned, our mission is to advocate for quality cancer care for all people touched by cancer. And we do this by impacting public policy, empowering survivors, and transforming care. And this picture is from one of our advocacy symposium. I'm going to tell you a little bit more about that later because it's coming up next week, and we'd love to invite you all to join us. But this was, I see Tia way back there in the background, and let's see, where are you, Loretta? I know you were there, but I don't see you in the picture right now. But we advocate to transform the healthcare system for the nearly 17 million cancer survivors and their families. And we really consider people to be a survivor from the time of diagnosis through the balance of their life. And that, so it doesn't matter what stage of cancer you're diagnosed with, what kind of cancer. We know that people use different words to describe themselves and their own experience. And for some people, the word survivor really feels good and fits, and other people don't like that word, and that's okay. We think people should call themselves whatever helps them get through this experience. But we advocate on behalf of everyone touched by cancer whenever they're diagnosed. And we also include family, friends, and caregivers, because we know that cancer is not just a disease, affects not just the person who's been diagnosed with cancer, but everybody in the family. We also know the number and age of cancer survivors in the country is increasing. As of last year, according to the National Cancer Institute, there were almost 17 million. And this year there were over 17 million cancer survivors. Part of that is because we have better treatments and people are living longer. Even with stage 4 and metastatic cancers, for certain cancers, people are living much, much longer than they did before. And you can see that there's many people living more than 5, more than 10 years after their cancer diagnosis. And that means a lot of the cancer survive. First of all, cancer itself is a disease of aging. You're more likely to get cancer as you get older. And so almost 2/3 of the cancer survivors are age 65 and over, which means that they have other medical issues that they're dealing with in addition to their cancer diagnosis. So back in 1986, when our organization was founded, there really wasn't a concept of cancer survivor. People who had cancer were still considered victims. And a group of people got together, they were cancer survivors, they were medical professionals, lawyers, who basically said, we don't want to be called victims anymore. We need to make people aware that we are living with cancer, living after a cancer diagnosis. And we need to make sure that there's quality to that life and that we're addressing the issues that come up for people after cancer. So that's how NCCS was started back in 34 years ago. And they've really helped bring both the change the wording so that people are called a survivor instead of a victim, but also the idea of survivorship and what does that mean and how do we take care of people with cancer after their cancer treatment. I think we've come a long way, but we still have a long way to go, and there's still a lot of gaps in that care, and a lot of cancer patients, and you all may feel this way. We hear all the time people who completed treatment saying that they felt like the first year after treatment was harder than the treatment itself because they felt lost in the transition to post-treatment life. This is Ellen Stovall, who was our CEO at NCCS for many years and had 3 different cancer diagnoses. She passed away in 2016 from the cardiac effects of her treatments. But she she was an incredible advocate and really a pioneer in cancer survivorship. But what she did such a great job of is focusing on, that we need to focus not just on the length of life, but also the quality of life and how we live after a cancer diagnosis. She was treated first when she was in her early 20s, and she lived to age 66, and she had incredible effects of her cancer treatment. They were really debilitating over the years, and that's with a lot of good care that helped her live as well as she could. But I think it could, if she didn't have that, she wasn't an advocate for herself, she would have had even more debilitating side effects of her cancer, but she was able to really get some of the care that she needed. So there's Miss Tia in the top picture. What we hear from patients that they want is really care that recognizes them as a person rather than just a diagnosis, and that helps people live well with cancer during and after treatment. And that's really a challenge because, the medical system is really geared towards treating the cancer. And it's an acute situation, it's a dire situation sometimes, and the focus is just on treating and helping the person get through that cancer treatment, and not necessarily on how well they're living during their cancer treatment and then afterward. We also hear from patients that they want help with the serious non-physical effects of cancer. Again, I think the medical community is really much more focused on physical effects. When we've done surveys of cancer survivors, what we hear from survivors is yes, my team did a good job of handling nausea and vomiting and some of the other physical side effects, but nobody talked to me about anxiety. Nobody told me that it was okay to feel, that I should expect to feel this anxiety or depression or fatigue or some of the cognitive effects that they feel from their treatment. And then we also hear from patients that they want the team-based care that includes coordination among providers. You know that you often see many different doctors and they're not always talking to each other. And you have to be that coordinator of the care, which is a big burden to place on people as they're already also going through a cancer treatment itself. So one of the things that we advocate for is trying to have better coordinated care, more team-based care, and then also that personalized care plan to help you navigate through treatment and then post-treatment survivorship. And we still feel like that, well, as much as we've advocated for this and we think it's really important, it's really more the exception rather than the rule that people get this personalized care plan at diagnosis and then when there are transitions in care, when someone either changes the treatment course of treatment or completes treatment. So some of the ways that we address what survivors need is advocating for public policy changes in how we regulate, finance, and deliver quality care. We work with other cancer advocacy organizations to address public policy issues. And then we empower cancer survivors through our educational programs, trainings, publications, and technical support. And then our symposium that I'll tell you a little bit about later. And you can see Miss Loretta in the picture there. That was when she was meeting with members of Congress, or I don't know which office you were meeting with then. Do you remember, Loretta? Probably your Senate office, maybe? Yeah.
Yeah, Shelby.
Oh, okay, Senator Shelby. Yeah.
Mm-hmm.
So, and it's so important for public policy makers and members of Congress to hear from cancer survivors about what you need, so because their decisions affect the care that you receive. So what we try to do is help people figure out how to share that experience in a way that's going to make a difference and help them to understand the cancer experience and what cancer survivors need. So when we talk about navigating to post-treatment care, the biggest message is it's not over when it's over. I mean, people talk about ringing the bell, and for some people that's a great thing. They feel very excited to be able to ring the bell. Other people hate the bell, and because maybe there are people with stage 4 cancer that are never going to ring a bell, that they're always going to be in treatment. But we know that even when the acute part of treatment is over, the cancer experience is not over, and that survivorship brings its own set of unique challenges. So why is that transition to recovery so stressful? Well, you all know this better than I do because I'm not a cancer survivor myself, but the fear that the cancer will return, concern about the ongoing monitor, loss of a supportive environment, and kind of being expected to re-enter. I hear from survivors a lot that, everybody, their friends and family that haven't been through this may think, well, okay, you're done, so let's move on. And it's not as easy to move on when you've been through that experience, and it takes a long time for your body to physically recover, so you don't have that sense of well-being because the treatment has really taken its toll physically, but then also the emotional stress and strain. So second is that cancer affects really virtually every aspect of someone's life. And I think that's where we see that the medical system, as I mentioned, focuses on the medical parts of it, but not necessarily all of those other parts of it. I think that there's becoming more and more understanding of the need to deliver more holistic care and to really help people with all of these aspects of their care. But it's challenging because the medical providers are very stressed, especially when you add COVID to the picture. And they also have, they have to see a lot of patients that are going through those acute needs. So it's hard, their attention then shifts from the people to the people who are now going through chemotherapy and not to the people who've finished and their needs. So I think it's going to continue to be a challenge that we all have to make the medical community aware of what survivors and patients want from their care, that they want that all the aspects of their life to be addressed, not just the medical. And so social effects, the isolation, and this is even before COVID, isolation was a huge issue. And now that we're all stuck at home, isolation is a huge issue. Changes in appearance and relationships, family issues, sexuality issues. That's a big one that people don't really want to talk about, but it is a huge issue for many cancer survivors, and it's sometimes challenging to address those issues because we don't always have the resources and people don't want to talk about it. And then there are the financial issues, employment issues, insurance issues, and then inequality in and outcomes. I mean, the outcomes are not equal across different races, and that's a huge problem. And then the psychological effects of fear of recurrence, chronic anxiety, uncertain future or lack of control, fear of dependency, survivor guilt, PTSD, and then chemo brain, which is really just a better way of saying that is that it's cognitive effects. There was a recent study that showed that those cognitive issues are really, an issue even with other kinds of treatment. Like people with radiation treatment or hormonal therapies can have these cognitive effects even without ever having had chemotherapy. And in this particular study, the study author said we should really just stop using the term chemo brain because those cognitive issues can happen even with other types of treatments, not just chemotherapy. And we also hear from survivors that often they don't feel like that the cognitive effects are being taken seriously, that they will bring it up to their physician who will say that that's not a thing. We've talked to survivors who've talked about PTSD and also, are not always supported in describing these issues that they're facing. So that makes it that much harder to get the help that you need. And then of course, spiritual effects, this new sense of normal. Some people hate that term, the new normal. Because you never go back to the same kind of experience that you had before, because the cancer diagnosis and cancer experience can, forever change you. And then the physical effects, the fatigue, pain, peripheral neuropathy for some people, that depending on the kind of treatment, and then late effects or delayed effects that don't happen for many years sometimes. Of recurrence or secondary cancers and other physical effects, cardiac problems, depending on the kinds of treatment that you had, lymphedema, osteoporosis. So another key message is that planning for recovery and life after cancer is important. And we have long advocated for survivorship care plans as a key part of optimal survivorship care. And it's meant to be a plan that helps you understand what treatments you've experienced, what the potential side effects of those treatments are, what are the kinds of long-term effects you may experience, and what are the kinds of monitoring that you need, and what do you need to do to get to fully recover, maintain your health, reduce your risk going forward. Unfortunately, there's been a lot of focus on the piece of paper of the survivorship care plan as opposed to the process, that it's more about the conversation and the discussion where between the between the care team and the survivor about what they need, what they need to know and what they need to do to help get their health back and monitor their health going forward. And also it's meant to be a way to help communicate among providers, because we talked about that care coordination being a challenge. And so if you have a survivorship care plan that you can share with your primary care physician or any other specialists that you may be seeing, that helps them to understand what treatments you've experienced and what the potential side effects of that are, because it's often a challenge when you're seeing different doctors who don't necessarily know all of your history, and a survivorship care plan can help them understand better what your cancer history was. But because the focus has been so much on the piece of paper, and there were some studies done saying that it didn't necessarily improve outcomes in the way that we would hope, it's been much more challenging for cancer survivors to get them. And what we do is we encourage survivors to ask for it. And your provider may not give it to you otherwise, but if you ask for it and say, I need this as a way to help me understand my treatment and understand how I can manage my care going forward. there are tools that allow you to build your own, but what it really needs is that medical history, the treatment summary, but also some guidance from your own provider about what you need. So it's something important to discuss with your oncology team and also with your primary care providers. And we believe it should be updated regularly. It's not necessarily a piece of paper that you just put in a drawer somewhere, but that you update it with your evolving health history, because as you have effects of your cancer treatment and receive treatment for those side effects, then that it can be an evolving, a living document. And then we believe that these survivorship care plans should address the whole person and well-being, and not just the physical effects of cancer. Another key message is that healthy lifestyle has an important role during and after treatment. And it's something we hear from survivors all the time, that they want more information about. What should I be eating? What kind of exercise should I be doing? What are the lifestyle things that I can do both to help me get through treatment, but also help me reduce the risk of a secondary or recurrence of cancer after? And it's again, something that it's not, the medical system isn't as geared toward providing that kind of information. So it does take some advocacy on behalf of survivors to advocate for themselves. And so what we hear survivors need is access to providers who have expertise in survivorship care. We need more research in the area of long-term and late effects of cancer, and better follow-up and to help identify those risks. We need to focus on wellness and quality of life, and not just getting through the cancer treatment. And insurance coverage for rehabilitation. So cancer rehabilitation is really a field that is not well known enough, but has the potential to really help cancer survivors deal with a lot of these effects of their cancer treatment. And it is often covered by insurance, but I think a big issue is people don't know about it, and oncologists aren't necessarily making referrals to cancer rehabilitation specialists. We had an expert in cancer rehabilitation do a presentation in March at a roundtable that we did, and he did such a great job of explaining how cancer rehabilitation can really help with all of these different quality of life issues. So it's something that I think we are advocating for, and we want cancer survivors to know about so they can ask about it, try to find it, because I think it's becoming a lot of it. This is really people who do physical rehabilitation can help you with this, but the cancer rehabilitation specialists are the ones who really know even more specifically about how cancer survivors need that rehabilitation. So self-advocacy is really about your ability to effectively communicate what you need and convey that to your care team, and negotiate or assert yourself and what your needs are. And it is a part of making informed decisions and taking responsibility for those decisions. So my concern is that not all cancer survivors are really equipped to be self-advocates. So I think advocating for yourself is a really important way to get the care that you need. But some people don't feel like they can do that, especially when they're going through cancer treatment. And that's where having a family member, a caregiver who can help you be an advocate for yourself when you go to your appointments, because you're really the expert in your own body and your own needs. And a lot of times, things will slip through the cracks if you don't advocate for yourself. So if you don't feel comfortable advocating for yourself, then maybe bring somebody with you who can help you advocate. But there are also tools. We have some tools on our website to help people become better self-advocates and learn those skills, because it's not necessarily something that everybody knows how to do. And some of those skills are about asking the right questions, about communicating, about problem solving. I mean, sometimes you have to be assertive and negotiate with your care team if what they're proposing to you or suggesting is not really what's in line with what your needs are, what your preferences are for your care. And why is self-advocacy so important? It gives you some stability and a feeling of regaining some control in your life, and help build confidence. and it helps improve your quality of life. So advocating for yourself can be the difference that turns into from feeling hopeless into and helpless into feeling hopeful. And then advocacy. Oh, sorry. Before I move into that, we also have a resource on our website called the Cancer Survivorship Checklist, and there's a link there to get that information. The checklist has two sides to it. One is if you're in treatment, and ways that it's basically things you can do to advocate for yourself, to be involved in shared decision making about your care, to ask for the kinds of emotional support you may need, or ask the kinds of questions you may have about financial issues. And then it also, the other side of it is really what you need to know when you finish treatment, and how you can advocate for a care plan, and you can advocate for the different things that you may need to help you kind of get your life back after cancer treatment. So we are also developing a new website that has right now the checklist is a PDF that you can download and print, but we're also developing a website that has customizable checklists and some more information for survivors, helping other survivors to navigate through this. And then I just wanted to mention about that advocacy for yourself is kind of where you have to start. You have to start by getting yourself through your own experience. But so many people like Loretta and Tia and maybe some of you have also turned that advocacy towards helping others. And there's so many different ways of advocating for other people, whether it be in support groups or just going to appointments with somebody who needs the support in their own care. I know that's harder to do right now with COVID, but sometimes for somebody going through treatment, just being able to talk to somebody who's been through what they've been through is so incredibly helpful. And then the other ways you can advocate is really look on a bigger picture level in terms of the cancer care system, and how do we improve the care overall that's being delivered, and how do we improve public policies. So that's what we try to do with our cancer policy and advocacy team, where we really support and engage advocates in improving cancer care. And we do that year round, but one of the ways we do that is our symposium, which is usually a 2-day training and meeting in Washington, D.C., and then a Hill Day where we go meet with members of Congress and their staff. And we have that coming up starting next week. It is a virtual symposium this year. So we start June 15th, and it's free. We have a lot of really great presenters and an excellent lineup of speakers. So we'd love for you to join us for that. But also our CPAP program, we have regular webinars and conference calls to talk about different policy issues, different advocacy best practices. We have an online forum, and we send out email updates with different advocacy opportunities. And then this is a link to, here's where you can find out more information about our CPAT symposium that's coming up beginning next week. And yes, if you just go to canceradvocacy.org/CPAT, you can find out more about the CPAT program itself, and you can also find a link to register for the symposium. And I think, yes, that was all I had in terms of slides. So I know that Tia and Loretta, you may have some questions for me.
Very good. Thank you so much. That was a lot of great information. And I'm going to guess Tia to kind of tune in and go through the questions. The one question that popped out in my mind before she gets started is when you talked about the survivor checklist, is that something we can download, or
Yep.
Can you make copies and send us stacks of them, or how do you process that? How do we get that?
The best thing would be just to download it, the PDF of it, and I put a link on that slide, but I can also, I can send you a link to it as well.
Okay, okay. And Tia is going to go through the Q&A part right now. Thank you.
Awesome. Thank you. And thank you so much, Shelley, for joining us today. This was really, really great information. You know, oftentimes, like you said, when you finish treatment, you're at a loss. It's like, how do I navigate life? How do I navigate this journey? You know, when is someone going to see me? Doctors may say, well, come back and see me in 3 months. And you're like, wait a minute, I've been seeing you every week. And now what's going to happen? So this was really, really good. We did get some questions that came in prior to the session, and so we want to just kind of throw those your way, and some of them you have already responded to. But one of the questions was centered around survivorship and medical follow-ups. What are some of the things that they can do or should know when it comes to medical follow-ups? What are the questions that they can ask their doctors and things of that nature?
So the checklist has a lot of that information, so that would be a great resource. I think, you know, the follow-up appointments vary in the time frame based on what type of cancer you've had, what kind of treatment you've had, and who you're seeing for those follow-up appointments. And you're right, Tia. I mean, sometimes it can be really daunting when you go from seeing your care team every day if you're having radiation or, you know, on a regular basis for chemotherapy to then saying, okay, come back in 3 months. That seems like a really long time. And then over time, it may get extended to 6 months or a year. And first of all, you know, often those follow-up appointments have scans associated with them. And we hear a lot of scanxiety, anxiety about the scan and what, you know, because people are, you know, even if you don't have any physical side effects, you may still be worried about recurrence. And so the follow-up appointments are often, you know, both a positive and a negative. But it's really, I think it's a good opportunity to bring up any concerns you have. And sometimes people don't even realize that a concern they have could be related to their cancer treatment. I was talking to one survivor recently who said she had an issue with her toe, and she just happened to mention it to her oncologist because they were friends, and it was not really, she didn't think it had anything to do with her cancer, but it did have to do with her cancer and the kind of treatment she had. And she wasn't expecting that, but there was actually something that they could do about it. And I don't know the specifics from a medical perspective, but I think, you know, one of the things to do is keep track of the things that are going on with you so that when you do go, especially if it's, you know, 6 months later, you can talk about, like, here are the things I'm experiencing. Is there any relationship to my cancer treatment? Is there anything I can do about them? Unfortunately, sometimes the answer, they don't necessarily always have the best solutions to some of these issues. And that's where I think sometimes having a rehabilitation specialist can be helpful, because there are things that they can do to help that maybe a medical oncologist might not be able to do to help some of these issues.
Awesome. Thank you. Okay, the next question is, and this is an interesting question. I don't know how you'll be able to respond to this one, but why are there so few good oncologists for breast cancer survivors?
So I'm guessing that means about survivorship care itself. I mean, I think there's so many breast cancer is such a, the incidence of breast cancer is so high that there are many breast cancer oncologists who focus on breast cancer, but they don't always focus on survivorship care. And I think part of that has to do with the workforce and how many oncologists there are compared with how many people with cancer. And the need to focus on the people who are in that acute phase that really need the treatment. But also, I mean, you know, unfortunately, medical care is affected by how we reimburse for care, and we don't reimburse well enough for survivorship care. It is, doctors get paid more for procedures, for giving chemotherapy. They don't get paid as well for just sitting down and talking to a patient. And a lot of survivorship care is sitting down and talking to a patient about what's going on with them. And that's just not where the money is, unfortunately. And it's not a slight against oncologists. It is just a way the system is built. So even if they care a lot about survivorship, they may be at a medical institution where they're put a lot of pressure on them to see more patients. And that means they don't necessarily have the time to sit down with you and talk about all of the things that are going on with you. And then, like, starting a survivorship clinic is really a challenge at some institutions, because they just can make more money by doing other things like giving chemotherapy. I mean, it's unfortunate, but that's really true. So one of the things that we advocate for is better reimbursement for survivorship care, and better incentives for survivorship care, so that we can see a shift in how we pay for care. It's the same as, it's like primary care. We don't pay enough for primary care. doctors have incentives to go into specialties instead of primary care. And then primary care physicians are overloaded because they're trying to take care of so many different patients and they don't have enough time with them. So it's not a great answer, but it's unfortunately the truth, I believe. And I think that what would be really helpful is if we had a way of like some kind of directory of providers who are really good at survivorship care. And we don't have that right now, but I think it's something I'd love to see in the future and something we've been thinking about. Is that something we could do, or maybe we could partner to really, find the providers, the oncologists that really do focus on survivorship care. And it may also have to be finding primary care physicians who actually care a lot about their cancer survivor patients and really take the time to learn what they need to know to help address the survivorship needs.
Awesome, thank you. Next question is, can you talk about being misdiagnosed due to cultural biases? Is there anything that you could speak to that?
Yeah, I don't really have a great answer there. I know it happened. I mean, we hear from people that misdiagnosis is a big issue across the board, but I think there's definitely a lot of anecdotal evidence, at least, and maybe more than anecdotal evidence, but hard evidence about that the misdiagnosis can be due to cultural bias. And I'm not an expert in that area, but it's something that's really important. And it's actually something that we have a session at our symposium next week on health equity. And it's something I will pose that question to David Scott, who's with the Roswell Park Cancer Center in New York. And I'll ask him about that because I don't have a great answer, but I do think it's an issue, and he may be able to talk about how they're trying to address that at his institution.
Okay, thank you. The next question is, what are some effective choices for African Americans living with cancer? And I think this kind of goes along with the survivorship more so, post-treatment. What are some things that specifically to African Americans, because we know that some of the treatments affect us far more differently than other ethnic groups. So what are some effective choices for African Americans living with cancer?
I would love if you would weigh in on this, and Loretta would weigh in as well, in terms of sort of where you see differences in the needs for African American survivors compared with, or if there are specific needs or specific treatments that may be more effective.
Loretta, you wanna take this one?
I guess I can, because I've worked with in our community. My biggest barrier is information, getting the information to the cancer survivors so they can make informed decisions about their health. And there's a lot of different reasons that's listed out there, but that's been my experience. That's my biggest barrier. Because most of the cultural things that's happening in our community is not the things that was created by our community, but we found ourselves subject to those things and have to navigate through them. So I think what we probably need to do, I think information, education to me is the biggest thing that needs to happen in order to overcome some of those barriers, because I do believe that the more information people have about any subject, the better they can make decisions about whatever it is they're dealing with. So that's just my little spiel on that. I hope that helps.
Loretta, are there different ways we should be providing information to reach different audiences?
Yes. Well, one of the things that we looked at when we started our program here in Birmingham, Alabama, is where are the majority of the people congregating? And so we went to those areas, which is the Black church, of course. And then the other one is community centers, maybe, and just family and friends. And so we have to be bold enough to step into those places with our agenda to show them that the more information you can get to feed to your congregation, wherever your circle is, then the better off that community will be. And so that was our primary focus, is to infiltrate those two areas, in the community, the church, and then the community centers. So that's where we started, and we made the greatest impact in those areas, which leaves out another whole section of community, because you got half of the people don't do any of those things. Yeah. And so the next step would be so far as going to the schools, and that takes a whole different approach, because now you're dealing with minors. So it's a big thing to kind of get your head around, but there's something you can do. And so we chose to go to the churches first. That was our first step. And we made a pretty good impact in that area.
Great. Awesome. The other thing that I was just actually on a call, and they were talking about doing pop-ups within the underserved community to be able to educate, continuously educate people just about healthcare and what they can do to just help themselves and how to be better advocates. So I think that could be, something else, like a toolkit provided to even some of the small grassroots nonprofit organizations on how they can do that and being able to share that information within the community. Another question was...
And Tia, when you say pop-ups, I don't know if everybody understand, but what you call pop-up is what we call health fairs. And they are performed throughout the community also, where we also participate in those.
Awesome, thank you. So the next question is finding the most effective ways to advocate. If we could talk a little bit about that. What are some effective ways that patients can advocate who have completed their treatments and now they want to be a part of the solution? Not only for, themselves, but others as well.
Yeah. I think that people have to think about, there's so many different ways to be an advocate. You can, some people are really interested in research and in bringing patient voices to the research and helping with designing clinical trial and learning. There's some people who just get really, and you don't necessarily have to have had a science background, but people find that they're just really interested in the science part of it. And then you can get involved with, you can participate in the medical conferences where results of clinical trials are presented, and learn more about the medical issues and be part of, reviewing clinical trial protocols and reviewing how they do informed consent for clinical trials. So that's one way. Sometimes it's just being involved in a support group and trying to help the people in the support group that are, maybe earlier in their journey than you are. And just by being there, more like one-on-one advocacy, sharing your experience with another person that is going through the same thing that you went through. And then there's, working with advocacy organizations like NCCS, like there's many organizations that some do direct support to help people, whether it's helping take them to giving them transportation to their doctor's appointments, or helping with food, or helping with other support during treatment. And then, some do more on kind of advocating for a policy change or advocating for a system change. So you can get involved with your hospital or cancer center. A lot of, most of the larger cancer centers and some smaller hospitals too have patient family advisory councils. And if they don't have one, they should have one. And it's a great way to bring the patient and family perspective to the providers about how they deliver care. The patient family advisory councils can provide make an impact on small things about, like, how the waiting room is structured, or small kind of things that can still make a big difference to people, like parking and things like that are important to you when you're going through treatment, but also bigger things about like how they structure their programs, or even the need for survivorship care at the cancer center. So those are just a few ideas of ways. There's a lot of different ways you can get involved as an advocate, and it just depends on kind of where you feel like you have the skills and resource, and where your heart is, and where you really want to make a difference. Sometimes it's like one-on-one, and like Loretta was talking about, going to the African American churches and educating people. So it just depends on kind of where you feel like you can make an impact and what interests you, because there's so many different ways to help other cancer patients at an individual level or big picture system level, and lots of places in between.
Awesome. So next question is, dealing with a diagnosis, I'd like to know more about resources that would have benefited the childhood cancer survivorship. Or in this case, this individual was diagnosed with childhood cancer. And so now that they're a little bit older, what are some of the things as a survivor they need to be concerned about in terms of advocating for themselves?
Yeah, I think that we have, so there's some real positives to pediatric oncology and how they've, most kids with cancer are treated at big academic medical centers that have a lot of expertise in pediatric cancers, and usually they have a good focus on survivorship. So there's a group called the Children's Oncology Group that really kind of brings together all the academic centers that take care of childhood cancer patients. And they have guidelines on survivorship care. The problem comes in when people grow up and become adults, and they're not, and there are people who are adults who are still treated at the pediatric, treated by their pediatric oncologist who they have the history with. Sometimes it's challenging. They get lost in the transition from being a childhood, being a pediatric patient to being an adult survivor of childhood cancer. And there are some academic centers and cancer centers where they will really take you in even if you weren't treated there as a child to begin with. Because what happens is people move, and so maybe you were treated, at MD Anderson, but now you live in Washington, D.C. And what do you do then? How do you find somebody to take care of you? That's why care plan is really important, because if you are in a different part of the country and you want to be able to, and you may not even, if you're treated at age 5, you don't even know what you went through. You don't remember all the treatments that you had to go through. So that's why care plan is so important, to be able to have that health history, to be able, when you're now 30 and go to a doctor in a different city, to say, here's what I had when I was 5 years old. And so, I've heard some adult survivors of childhood cancers talk really eloquently about how they just really had to demand a care plan that had that treatment summary that really helped them to be able to manage their care going forward as an adult in a different part of the country where they still don't have the same providers that they had. Because there are, the effects of cancer, especially when you're a child and still growing, there can be some very serious long-term side effects. And some of those things don't come up until much later. So it's really important to know what those could be and to be able to manage them. But it's hard if you don't have all of the data that you need. So I think one is getting that care plan. And then second is the Children's Oncology Group has really, really good guidelines for survivors of childhood cancer about what they need for their survivorship care going forward. Better really than I think some of the guidelines for adult survivors of cancer is the Children's Oncology Group has done a really good job of putting together those guidelines. It's just a matter of making sure that you get someone to help you follow those guidelines, but where you may be now, which may not be where you were treated when you were a child.
Is there any kind of programs or apps or anything of that nature that you can kind of create a care plan if your provider is not offering one or not giving, they don't have that at their facilities?
I believe that there was one that we had been a part of called Journey Forward that has, that was basically taken down. The support groups that collaborated on it decided that it had sort of outlived its effectiveness. It was created early on before oncology practices sort of figured out their own way of doing care plans. And some of them do have the capability to create them. But I do believe there are some resources for people to do it themselves. And I can follow up with you with that because I don't have it off the top of my head. Journey Forward is one. OncoLink, that's a good one, yeah. And I think there are others, but I can get back to you with links to them.
Okay, awesome. And the last one is around anxiety. What are some of the tips? What are some tips to help with anxiety before I go to the doctor? And I think this is really a good one. And maybe Miss Loretta and I can add some feedback to, because we are survivors. And so it's kind of what we deal with frequently. And if anyone else want to, jump on the chat or chime in about how do they deal with their anxieties, especially the scan anxiety, feel free to do so. So one of the things that I do, I mean, there are multiple things you can do. I truly believe that everything starts in the mind. When it comes to this journey, and again, these are my thoughts, my opinions, I'm just sharing, that you have to mentally kind of, amp yourself up and be positive and really turn to things that's going to help you to be in a place of positivity, whether it's music, whether it's, getting up and dancing, whether it's prayer, whether it's quoting affirmations, whatever it is that can help you. But I truly believe that, there's power in that. And I know when I go to the doctor, those are the things that I do to help me. Also for others, having a conversation about it, just being open to saying, this is what I'm feeling. I remember going to the doctor and I was so great. I was so good. But once I got into that room, it was like a sense of fear just came over me. And I started to get the sweaty palms and my hands started shaking. And in that moment, I put on some music and I just started dancing and just, start saying positive things, to help me kind of prepare myself for the feedback that I was about to get from my doctor. And it really calmed my nerves because in that moment I was a wreck. But I think some of those types of things can help. And like I said, just being transparent about your feelings, telling your doctor what you feel, having a conversation with someone else that you trust, and letting them know, hey, I'm having this moment. And I think if we hold it in, that doesn't make it a good situation for us. So those would be some of the tips that I would say. I don't know, Miss Loretta, if you want to share anything.
I just want to echo those things that you've said because, but my main go-to is prayer. There's a common effect that comes over me when I pray. And so any stressful situation I find myself in, I just kind of sit back, take a deep breath and breathe. And then whatever that challenge is that I have to face isn't so big anymore. And so that's just personal the way I would handle it. But I think all the things that you mentioned are great. And then we have to be mindful of whenever there's a shift in our thinking or things seems to be bigger than what we can handle, you just have to take a moment for yourself and become part of whatever that is and just be in the moment for a few minutes and then move forward into it. And I found that when I do it that way, I can work through whatever that challenge is much better.
Awesome. Thank you.
I would just like to add that we do have a session at our symposium next week. It's on Tuesday it's called Gaining Perspective on the Cancer Experience, but it's really about managing stress, anxiety during cancer and after. And we have a wonderful woman named Susan Headland, who's an oncology social worker from Oregon, who's going to be presenting that session. And so I think that'd be a great one to listen to as well.
Awesome. Well, let me see if there's anything else in the chat. Does anyone have any other questions? I think someone posted something earlier and maybe that was.
Well, I did have a question that I wanted to Shelley.
Miss Loretta, I can't hear you anymore. Are you on mute?
I must have. I'm sorry. How do you think the landscape in healthcare will look after the pandemic, given our struggles with cancer policy and changes in the past for our patients? What I'm hearing from a lot of patients is that it's a challenge now just to be able to work through the new technical virtual visits that we have to go through. And so when we come out of this, what do you think going to be the biggest downfall, and maybe mention a few of the successes from it?
Yeah, well, I mean, you mentioned telehealth, which has been it's like a huge shift in how all medical care is delivered in a really short amount of time. And there were some regulatory barriers that why telehealth wasn't used more frequently before. And a lot of it had to do with payment, but also some rules about, seeing patients across state lines and things like that have, changed temporarily during the pandemic. So I think a big question will be what happens after that. I think that, so we have a project where we wanted to, it's like this rapid shift in how care is delivered, but no one's really asking patients what they think of it. So we wanted to bring patient perspectives to that and how, what's working well, what's not working well, how can providers better help address the barriers people have to accessing telehealth, how can patients themselves prepare for a telehealth visit, and what are the types of things that should be done via telehealth and shouldn't be done via telehealth. So Loretta knows this because she's on our steering committee working on this project where we recruited people from around the country, all different kinds of cancers, people who are in treatment, people who completed treatment, and did a series of focus groups asking them all of these questions. And we got incredible feedback. We are working on pulling it together. We're going to be sharing a little bit of it, the early results from it at our symposium in a couple of weeks. Well, it starts next week, but then this session on telehealth will be the following week. And our hope is we're going to create a couple of resources, one for patients, one for providers, but also some policy recommendations. There are a lot of benefits to telehealth if you spend a lot of time going to the doctor, going to different doctors, sitting in waiting rooms for doctors who are running behind, there's a lot of transportation needs, taking time off of work. And if you can sit at home in the comfort of your own home and keep working on something else while you wait for your appointment, and it can be a huge benefit. But there are some types of visits where it's not really great to do it via telehealth. And then you've got to deal with the technology, which, a lot of people have learned, just in order to, I remember you talking, Loretta, about like, you didn't do Zoom meetings before all of this. And now you've taught yourself and you've taught other people how to use Zoom to stay connected with each other. And then knowing how to do it for that also helps make it available for telehealth. But then there are going to be people who they're just not going to be able to do an appointment by telehealth. I think what's going to be really important is making sure that patient preferences are respected. So if you want to be in person, you should be able to be in person once we get past, some of the limitations of the pandemic. If you really want to do it as a telehealth visit, you should be able to. So I think, how some of the policy issues and how we pay for it is going to really have an impact on what happens going forward. But we're trying to make sure that what we hear from patients and what patients want out of this is respected. And so it's an ongoing process for us. And I'm thankful to Loretta and the other patient advocates who are part of our committee, helping us really to recruit the members, but then also review what we heard from focus groups and make sure that we're making the right kinds of recommendations that will benefit cancer patients.
I have another question that came through the chat. Okay. Why was the guidelines concerning alcohol changed for cancer prevention?
And this is not my area of expertise, but we did have a presenter from the National Cancer Institute who spoke at our one of our roundtables last year. And there is increasing evidence about links between cancer and between alcohol use and cancer. And I'm not an expert on the data, but I think it's a growing area of study. And the more evidence points to that, it does have an effect on certain types of cancers and recurrence rates and cancer incidence rates. So I think that's why I can't speak to all of the details, and I think it's still an ongoing field of study, and I think we'll be hearing more about it in the future. But so that's why there were some recommendations to limit alcohol consumption, because it does play into recurrence and incidence rates.
And then the last question is, how will this I guess, and it's kind of piggybacks off of what Ms. Loretta was talking about. With all that's going on, telehealth, are we expecting to see a larger gap in disparities as a result of this? And also, are we expecting to see more cancer deaths, where the number of survivors that we have now, we will see that decrease? And will we see more patients being diagnosed at later stages as a result of all of this that's going on?
Well, so I know you guys had Dr. Otis Brawley a few weeks back, and he's really the expert on all of this. And I adore him and love to hear him talk because he's so smart and he explains things so well. But we are hearing a lot of concern that people are going to be diagnosed at later stages because they're not getting cancer screenings and they're not getting care. I mean, and it's not just related to cancer. There's been a lot of concern expressed that people are going to the hospital for things they should be going to the hospital for because of the pandemic, like heart issues or, not just cancer. But when people aren't getting screened, or when they have concerns, but they're not getting them addressed, or when we had, a lot of cancer surgeries weren't happening because they were considered elective. Elective just means that it's not emergency. So it could be still like a very critically important surgery, but it's scheduled in advance, like for to remove a tumor, and some of those surgeries weren't happening. So there's definitely, I've heard concerns expressed by medical professionals that they're worried that people are going to be diagnosed at later stages. And I do think that could exacerbate some of the disparities in outcomes. I don't know about telehealth and disparities. I think that's a really important question we need to look at, but I don't know what the data shows on that. But I do think, now that we're 3 months in or longer in some parts of the country into this, what doctors' offices have had to do is figure out how to keep patients safe and their staff safe and still deliver care. And I think they've done that. I know I thought it was interesting. I was getting some emails and texts from doctors' offices I've been to saying, we're open for business, because they want to, they need it for their business, but also people need care. All of this health care that people were getting was not elective. And so I think, we're to a point now where you can probably go get screenings without, being concerned. I mean, you need to talk to your doctor about it, but early on it was maybe we all need to be staying home, but now maybe we can be going back for certain types of, depending on what it is. And I'm not a medical professional, so you talk to your doctor about it, but I think there are more types of appointments, screenings, visits that can be done now and can be done safely. So I think it's important that we make sure that we're not overlooking care that needs to happen because of the pandemic. So it's important to talk to your doctor and find out, is this something I need to do now, or is this something that can wait?
Awesome. Well, thank you so much. I know we've run a little bit over our time, but I just want to say thank you so much again, Shelley and Miss Loretta, for, being a part of this conversation. It's really, really good. It's much needed, because every day, we have a new survivor and someone who's lost in the shuffle and trying to figure it all out. Loretta, do you want to go ahead and close us out?
Yes, I can close out with saying that we want to thank our sponsor, Amgen, for assisting us with this platform. And you will be notified of the winner for this one at our next session, or probably before, because Tia is so good about sending that email out to the winners. And so we had 3 people to win at our last session, and they will be getting their gifts very soon. So with that, thank you guys. Thank you again, Ms. Shelley, for all that you do. And I do want to say to this group that I've done several national organizations to serve as panelists and help to get the word out on the national level. But National Cancer Coalition Survivorship is one of the ones that has really reached back out to me and helped me to grow in my community, especially with the ambassador program. I don't know if Shelley mentioned it, but that is one of the great programs that they have that teach you how to be stronger advocates in your community. So I'm just hoping everybody go ahead and sign up for the symposium that's coming up with National Cancer Coalition Survivorship. I think it starts next week.
It does start next week, yes.
And then Heal Day is the following week.
That's right. So, if you just go to canceradvocacy.org, you can find it on our main page. And we'll love to have you. We have a lot of great presentations and discussions. So I thank you so much, Loretta, for your kind words, and to you and Tia both for being incredible advocates, but also for inviting me to join you today. I appreciate it.
Thank you. Thank you. Thanks, guys. Bye-bye.
Have a great day.
Bye-bye.